really honored on behalf of the regional minister to welcome you all to this region of plenty potentials. I always say that our region, even though we happen to be within the poverty line, and I think your visit is apt, because when we are talking about poverty indicators in the country, definitely our region is part of it. But I feel that we have a lot of untapped resources, which when we are able to do it very well as a country, maybe it will help to address poverty situations.
Honorable Regional Minister, Chief Director of Protocols observed this group, which you are already aware, is the Poverty Reduction Strategy Committee of Parliament. We are most grateful for you for the warm reception that we have received. Indeed, the clerk has told me severally his personal contacts with you, either through WhatsApp or on phone, and your willingness to receive this group to enable us to perform our oversight responsibility. Poverty has no political coloration. Poverty cuts across all sectors of the country. And if you look at it, poverty has become an issue globally that, because of its importance, the United Nations decided to set up a commission, of which our president is a co-chair. So we are here, we are not coming to find faults or do anything negatively that will affect the districts, but to get the raw data, the information that will help us to put up a strong case to see how the best poverty can be eradicated in this country.
I hail from this region, and I can see my big brothers here on Rawaka. I have a sister there. The chairman himself comes from, in fact, the richest constituency, I would say. Yes, I know him. And the question I've always been asking myself is, why is it that Upper East is poor? I've been asking myself this question, and luckily I'm here to answer that question. We shouldn't be poor at all. Those of you who are not from this region is very rich region. So, as I'm here, I'm trying to figure out, apart from what is written in the books, why people can be poor, what is it that we are doing wrong that we haven't developed, or we haven't used our resources that we have here to develop. So I have identified a few of them. Maybe the two major ones, politics and then tribal. I keep also asking myself, you have a lot of our development partners here, NGOs here. In fact, capital of NGOs in Ghana is Tempane. So these people are all here to help us develop. So why is it that we have not developed? So I keep asking myself this question also. And then I realized that is what coordinator was saying, that I want to do things differently to achieve different results. So the NGOs that comes through the region, I try to tell them to change the way they do their things. For example, the data. For example, coordination. For example, evaluation. And also to target what actually the people want. So thank you very much that you're here in my region. I'm very grateful and honored. And for me here, as it's already said, I am a regional minister for all, not for only MPs, not for NDC also. We are one, and I've told everyone, let's put the politics aside, when it comes to 2024 or getting to 2024, I'm sure we'll meet in a share.
Our mission is very clear. We want to probe deeper into the results that have been communicated either by the Statistical Service, the Ministry of Health, the Ministry of Education, and in all poverty status of your districts.
We received your communique about a week back, and we've since been together waiting to receive. So we thank God for receiving. Poverty, actually, in this part of the region, is more recorded in the Garu district, as we can see from the reports from the Ghana National Household Registry exercise that was conducted a few years back. Garu and by extension Tempane are down the league table in the region. And so, as officers of the Assembly, our concern has been how to ensure that all the policies, the poor policies that are being run in our district are effectively run, that will inure to the benefits of our people. And so clearly, when it comes to issues of poverty, we are more than actively involved, we are more than actively concerned. And so this very important committee's visit to our districts is more than welcome news. We are aware that at the end of the day, you will be able to appreciate more the state of poverty and inequality at this part of our country, especially in Garu here.
So today we are going to look at 3 of the SDGs, goals 1, 3, 4, others, poverty, health, and education.
How many people were involved in their project? And how were they selected? Was it based on maybe one per household? And how long? Because if we are paying 4 cities a day, then we can estimate what maybe one person will get.
But the mode of selection is first they consider that the person or the household must be a new household. Not just the person who just look at it and give you the money. It should be a new community. The community should be a new community first before it qualifies for the LIPW project.
The first one, 3.1, by 2030, will reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Do you have this in another one?
No, Chairman.
Annually, what we do, we submit to the disassembly, and then coming to this meeting, we didn't have review of this.
So if you don't have weekly information for us, how can we make progress? I'm going to ask you, if it was approved, how much was released, how much was spent and all that. If you don't have this information, how do you make progress?
I think it has not been very good here. And let me say that we had a very good session with the regional minister. So whilst coming here, we had high hopes that they would have prepared the way we expected them to prepare based on the template that has been submitted to them. But as you observe, it means that very little has been done. And that was why we have not been able to achieve a lot. But hopefully, as I've directed them to submit the data that we require or requested for, I believe that they will be able to do that. Otherwise, it means that we'll leave the region, we've not found memories of this assembly, but we'll be wondering whether any work has been going on at all.
have realized that the LEAP program provides free health care for all LEAP beneficiaries, not only the housewomen, but not only the caregivers, but the entire beneficiaries. So the gap has been that these people have not been able to, have not been accessing that because they were not having the health insurance cards. So we were able to organize 2 registration and renewal programs in 2020 for these beneficiaries. As part of our plans, annual action plans and the plans we submitted for the medium term, as of 2020, we were able to update our PWD register to a total of 1,077. And so we targeted that, at least by the close of the period, 1,077 registrants, PWD registrants.
You just gave us a total figure of 570056. I don't know whether it tallies with the document they are just giving us.
Over the years, one, have the numbers been increased? Because I don't think we want to target someone as being poor forever. So, of course, there should be some preventive measures so that we don't keep on getting more poor people in the society.
We have success stories by farmers who did composting that we have even prepared and sent to national level. Success stories of farmers who have succeeded by using composting. There is a woman at Yemerga. She started with the husband passed on. She took over the composting by herself. She was able to make 16 bags of maize from 1 acre. But when you take the watershed land that we did and ask them the yields they are getting, they will tell you that 3 to 4 bags per acre.
He said by 2030, as enshrined, ensure that all girls and boys complete free, equitable, and quality primary and secondary education, leading to relevant and effective learning outcomes. So you look at our indicators. That is 411 indicator. That is proportion of the children and young people, A in grades 2 and 3, B at the end of primary, and C at the end of lower secondary, achieving at least a minimum proficiency level in 1, reading, and 2, mathematics by 6. That is our target.
As of 2020 and early parts of this year, we're working with doctors at the district hospital. Now we're down to 2 doctors. So it means 1 doctor is to half of the population, over 100,000 people. Meanwhile, the target should be that 1 doctor is to 8,000 people of the population. So that is a challenge there. And in terms, if even we come to the health support staff, like the cleaners, the orderlies, the watchmen, those are the records, those are the dispensary and stores. We don't even have this staff existent at our facilities.
We see this interaction as important because the committee will be able to also articulate our views, the issues that are so critical to us, the issues that are worrying us at this level that we are not able to address them. They are able to do this because 1, they are even members of parliament, and so they are able to team up with the executive arm of government to address the issues that are challenging to us. And we again, every monitoring and evaluation forum is an opportunity to assess yourselves. And so it also gives an opportunity to get to know where we are as a district.
National, across all the 16 regions, Upper East is targeted by the poor region. And then we have a lot of districts that are also in the public sector. So that accounted for the poor, the district being counted as a poor region. And then this intervention that we have put in place have to go a long way to reduce this poverty.
The expectation is that all the districts would have done a similar thing. And so your budget would be aligned with specific SDG targets. And all the targets, SDG targets for these 3 goals, we have populated them in these templates. But it does not mean that you would have budgeted for the year 2020 or 2021, all of them, just like the case of the other district I just showed. You, based on your priority, may have picked some.
The overall student population is 13,842. In the other indicators, pupil-teacher ratio. For KG, the ratio is 4 to 1 learners to 1 teacher. Primary, 58 learners to 1 teacher. Junior high school, 16 learners to 1 teacher. And then senior high school, 18 learners to 1 teacher. Textbook ratio for KG is 0. Primary, 0. Junior high is 0, but here we have some books at the regional office for junior high 1, which we are still to collect. The turnover rate of teachers in this district is not the best. You go to some of the schools, teachers are compelled to do multi-grade teaching. Because the classrooms are there, the children are there, but they are not teachers. So the teacher has to teach 3 classes at a go, moving from one class to the other. Early marriages and teenage pregnancies is another issue affecting education service delivery within the district. They are cutting our learners very young. They won't allow them to progress to whatever level that they wish to.
I've just been elected as the MP for Cape Coast, and the very first time I visited all the basic schools, I cried, because I never knew that in Cape Coast, which has to be the first capital of and then Gold Coast, has kids sitting on the floor. So this is what I did. I initiated Operation 2,000 Desks. So as an MP, I identified some stakeholders within my constituency and then taxed them. And the churches. I went to every church and I said, every church, I want you to support our kids. Give us 20 desks. One is 200 cedis. We are coming to get it at the end of December. I went to all the telecommunication companies and I said, this is what I want you to do to support our kids. So you are all giving me 20 each. I am providing 500. So I provided 500 and then these institutions are going to support me to get a 2,000 for the kids. So I beg you, identify stakeholders, philanthropists, and try as much as possible to see how you can raise this for our kids.
Proportion of deliveries attended by a trained health personnel. So we made a little improvement from 51.9% to 53.1% in the year 2020. So currently I'm the only medical doctor in the district, and I came in the year 2020. And it means that one person handling the whole total population of about 45,000. And the target is supposed to be 1 doctor to 8,000.
I just want to find out, where do you refer cases with the absence of district hospital?
The Riaga Hospital, Sandema Hospital, and then to the regional hospital in Bolga.
We're fortunate to have the Parliamentary Select Committee on Poverty Reduction Strategy coming to have kind of discussion with us on the Sustainable Development Goals. The essence of it all for me is how it gives us a fair idea of how we are doing well in terms of health and how we are doing well in terms of education and how well we are doing in terms of poverty reduction. And I think the presentation brought to light some successes of the district, and where there are gaps, we looked at it as to how
we can improve on it.
I just want to thank the whole team for coming all the way to come and see what is happening in Builsa land, to come and have first-hand information of the data. And we pray that as the team gets back to Parliament, they would be able to take the necessary actions and then make the necessary or champion the necessary advocacy for Builsa South.
I want to take the opportunity to thank the members of the Committee for Poverty Reduction Strategy, and ASEPA for choosing Builsa South to have such an important national exercise.